Well, when it comes to your health, it can be pretty hard to fully understand a diagnosis.
And after that diagnosis, it seems like you have even more questions. So here with us today, Dr. Robert Cavalieri and Dr. Michael Olson from Baptist MD Anderson Cancer Center talk about brain cancer and what happens after that diagnosis. Good to see you, gentlemen.
Hello. Thanks for having us.
So let's start it off at the basics. Brain cancer, what is it? What are the types?
Yeah, go for it.
So we could break brain cancers down into two types. The first type would be metastatic disease, which would be a cancer that originates from somewhere in the body and subsequently progresses to involve the brain as a secondary site. The second type of cancer is what we would refer to as the primary brain tumor, which would be a tumor that originates from the substance of the brain rather than spreading there from a different location. The most common type of that variety is the glioblastoma, which is what Senator McCain had suffered from. But collectively, they're all pretty disabling and difficult conditions to manage and treat.
Yeah, that definitely sounds difficult. And talking about this topic is probably difficult as well if you find out you have a diagnosis. But if you have a tumor, not all of them are necessarily cancerous, right? What is it like if you have a non-cancerous tumor?
Well, it's interesting because both the cancerous and the non-cancerous tumors can have very similar symptoms. It really has to do with where in the brain it is as opposed to necessarily what type it is. Sometimes the non-cancerous tumors can take longer to present with symptoms, so you might develop symptoms over months or weeks as opposed to days or hours. It also can depend on whether you have seizures, which can occur with these sorts of tumors as well.
Talk about a little bit. Unfortunately, I'm aware of the secondary site one. My mom had one that broke the blood-brain barrier, as they call it, from her cancer. But what makes the tumors that start there, the primary one, what makes them unique?
So the most unique part of a brain tumor is the brain. It's a very unique, very delicate, very sensitive organ. So it's very interesting in that, you know, the same disease, identical disease in different parts of the brain can manifest very differently. So that affects the way we see patients and even potentially how we manage them, specifically which part of the brain is involved. Also, the brain being a delicate and such a critical organ in our body, one of the issues we run into quite often is the significant disability associated with brain tumors, and that in and of itself becomes a huge barrier to effective treatment, is the disability that patients suffer from these diseases. So that's what makes brain tumors so unique, isn't the nature of the brain tumor itself, but the part of the body that it involves.
Yeah, definitely, because I mean, what can you do without it? That's kind of the motherboard of it all. So
exactly.
Is there anything as far as symptoms that people can possibly catch, like or be aware of?
Yeah, you know, there are a variety of symptoms that tend to go along with brain tumors. Unfortunately, a lot of these are common everyday symptoms like headache or nausea. But there are the common things that we ask people to look out for. You know, sudden changes in personality or confusion or imbalance that persists over long periods of time. Generally, a headache that comes and goes we're less concerned with. One that's there every day and is slowly getting worse, that's a whole different story.
The standard, if somebody's having something like that, those symptoms, and what is the way to diagnose it? Is it a CT scan? What do you guys use?
So the most common imaging modality we use is MRI, which provides us with a pretty detailed picture of the brain itself. It's a non-invasive test. It doesn't involve unnecessary radiation exposure, but it gives us a pretty detailed anatomical look at the brain. We do sometimes rely on other imaging modalities as well, things like CT scans, but really the backbone of imaging and diagnostics for us is MRI of the brain, which also facilitates in treatment planning. So if we have to direct a therapy to a tumor, or surgical planning, how to access the tumor. So it's not only a diagnostic tool, but it's also a tool that helps us treat the patients as well.
So you have tools to diagnose it. Is there anything that people can do to prevent it altogether?
Yeah, I wish there was. We unlike with lung cancer and some other diseases, we don't have the thing that leads to most people developing a brain tumor. We know that radiation exposure of any kind can put you at risk, but there really isn't anything else that we're aware of at this point.
So, all right, well, real quick for viewers out there, is this something they should come to Baptist MD Anderson Cancer Center if they're having those type of symptoms, or talk to their doctor and request an MRI?
So that's always a challenging point. I think we always borrow the awareness from stroke, and the things that we see in stroke are the same things we should be aware of for brain tumors. It's the same organ, it's the same disease manifestations. So if you see those kinds of symptoms, generally they should be addressed, and often that involves an emergency room or bringing it to the attention of your primary care doctor, whatever it takes. But those stroke type symptoms are the things that people have to be aware of.
Great information, fellas. Appreciate you being here.
Thank you so much.
Absolutely. Thank you.
As always, a huge thanks to Baptist MD Anderson Cancer Center for being here and sharing their services and this information. If you'd like to learn more, you can head over to their website at baptistmdanderson.com.